graduate education getting capped. This is your brief but brief. Following the passing of the Big Beautiful Bill, the Department of Education has had a lot of reshuffling done. One that's gotten significant attention as of late are the changes to graduate student loans. Previous to the bill, prospects borrowing from the government in excess of directly unsubsidized loans would apply for Grad Plus loans, which were unlimited in its borrowing limits. Following this bill, that is completely eliminated. Now there is only direct unsubsidized loans with a key separation: professional and graduate degrees. Graduate degrees would receive the same annual borrowing limit, but with no option in excess of that, in addition to a lifetime cap of $100,000. Professional degrees, on the other hand, would have higher borrowing limits, marked at $50,000 annually. Same situation, you can't borrow in excess, and a $200,000 lifetime cap. Then came the question, what is considered professional versus graduate? That's what this committee, implemented by the Department of Education, would answer, developing this exclusive list of what are considered professional degrees. The controversy arose with what wasn't on the list, in particular nursing, which the committee included in a list of other degrees that were specifically excluded from being considered professional. The committee's rationale: 1. These professional degrees were already exemplified in this part of the Higher Education Act from 1965. 2. The Department of Education had a preset criteria for the committee to consider what is professional, but nursing and many others didn't meet it because of this caveat with what are called CIP codes. Think of CIP codes as the Dewey Decimal System at the library. It's just meant for filing purposes. Here's the problem with all this rationale. This law was specifically written for data tracking purposes, not policy. The law's provision of this list is phrased included but not limited to. If we're going off the criteria, a professional degree as theology doesn't necessarily require a government license or 6+ years of study. And with CIP codes, nursing is categorized similarly to other health-related fields that are professional. But the Department of Education expanded that code by 2 more digits, making it more hyper-specific to qualify. Let's call it like it is: loosey-goosey language to formalize cost cuts addressing the student loan debt crisis. The government caps annual and lifetime borrowing limits to put the burden on private student loans to fill the gap. Further limit what degrees are applicable for higher amounts borrowed, and focus on degrees that are more than likely to enter the public service and become applicable for getting the rest of their federal debt forgiven by the government. And this doesn't even touch on how the amount of coverage provided by these